welcome to MINK News Network. Oh wow, it's chilly outside. But enough about that. Let's talk about how stem cell transplants are now being used in patients with leukemia to help regain lost blood cells from chemotherapy. Leukemia, a cancer of blood-forming tissues that hinders the body's ability to fight infection, is a very deadly disease. According to the Leukemia and Lymphoma Society, just in the U.S. alone, 58,100 people died in 2018 as a result of leukemia. About every 9 minutes, one person in the U.S. dies from leukemia. Scientists hope that with these stem cell transplants, some of these tragedies can be prevented. These stem cell transplants can really make a difference in one's life. We will now hear the heartfelt story of Isabel Margetts, who was diagnosed with leukemia. We will also hear from her doctor, Dr. Miyake, and a stem cell researcher who graduated from Harvard University, Narelle Ben-Joseph. Let's first meet Isabel.
Yes, it's true. Unfortunately, I was diagnosed with leukemia. I've lived in Greece all my life, so I'm used to seeing many of my friends and family be diagnosed with it as well. Actually, my best friend was diagnosed with leukemia, and it was so difficult for me to watch her go through chemo. Unfortunately, she wasn't as lucky as me to be able to undergo a stem cell transplant.
Aw, Isabel, I'm so sorry to hear about that. Can you tell us more about your job in Greece and what you believed increased your risk of getting leukemia?
Yes, of course. Although there is no way to prevent leukemia, being a worker on a chemical plant increased my chance of getting it. As a chemical plant employee, it means that I have exposure to certain chemicals, such as benzene, found in gasoline, which is linked to an increased risk of leukemia. Benzene has been shown to cause chromosome changes in bone marrow cells in the lab. I found out I had leukemia when I started getting symptoms and went to my doctor for examination. At first, I didn't think much of my sudden loss of weight. I then started having recurrent nosebleeds and bruising. I knew I had to go to my doctor when I started having persistent fatigue and frequent infections. My doctor immediately sent me into chemotherapy.
Wow, yeah, that must have been so difficult for you. And after you went through chemo, I heard you also had a stem cell transplant. Is that true?
Yes, that is true. I was lucky enough to receive a stem cell transplant. My doctor recommended that I received an autologous transplant, since allogenic transplants are known to sometimes cause graft versus disease.
Thank you so much for sharing. Isabel's doctor is actually here today, and she'll be talking more about leukemia. And this person right here is one of the most well-known doctors in Greece. She has over 300 patients, one including Isabel Margetts.
Hi Karina, I'm so glad to be here. My name is Dr. Miyake, and when I first gave Isabel a normal checkup, I instantly knew something was off. Isabel had swollen lymph nodes, so I gave her a blood test. I checked samples of cells from her blood and bone marrow to be sure. Sure enough, she had an above average amount of white blood cells. So I recommended that Isabel went through chemotherapy to kill some of the cancer cells. Finding new and beneficial ways to treat cancer is very important since there are so many people in the world that are struggling to fight it each day. The amount of people diagnosed with leukemia has been rising over the years. According to the National Cancer Institute, approximately 1.5% of men and women will be diagnosed with leukemia at some point during their lifetime. So stem cell transplants can help those with leukemia by allowing the patient to regain the cells that are lost during chemotherapy.
Wow, thank you so much for being here today. We will now hear from Narelle, an expert in stem cell research.
Thank you for having me on the show. Stem cells are specialized cells that can develop into specific cells over time and renew themselves through cell division. Because of this ability, stem cells can not only help patients with cancer, but also have the potential for treating diseases such as diabetes and heart disease. For this reason, stem cells are known as regenerative medicine. Hence, with stem cell transplants, patients with leukemia are able to regain the lost blood cells from chemotherapy. This is a life-saving technique that has helped thousands of people worldwide who have been suffering from blood cancers.
Yeah, that's amazing. Can you tell us more about stem cell transplants?
Yes, definitely. A stem cell transplant is a procedure during which doctors either replace diseased or infected stem cells with healthy new stem cells or allow high-dose treatments for lymphoma, some testicular cancers, and other diseases. There are two different types of stem cell transplant. One is called analogous transplant and the other allogenic transplant. Well, an autologous transplant uses the patient's own stem cells for the procedure, and allogenic transplant uses a donor's stem cells for the procedure. As you have recalled, Isabel had received an autologous transplant.
Wow, that is truly amazing. We'll be all over MNK News today. Thank you everyone for tuning in. So much for sharing. Isabel's
Received an autologous. Wait, you need to tell me how to say that word.
okay, cut.
Cell division. Because of this ability, stem
You freaking walked through
Oh, this fell.
research.